Well, the sector would argue that there's going to be a workforce crisis on top of an existing workforce crisis in the sector. They're already massively understaffed. There's about 112,000 vacancies and counting, so they're very worried it's going to get even worse. They're not against vaccination. They're in fact very strongly for it, but they are against forcing people to be jabbed. And they point out things that, like, we're only just 7 months into the vaccination programme of people having jabs, and so their view is that gentle persuasion is actually the best way. Otherwise, they say, this workforce shortage in social care will become absolutely catastrophic. And they want clarification on all of this because at the moment the worry is, as Nicola Richards said, people are leaving care home jobs and they're possibly going to other sectors like hospitality, etc., but they're also going to home care or the NHS because they think that that is the best way to avoid compulsory vaccination. But if it is brought in across the social care sector, then people will leave it altogether and the sector will lose all those skills completely.
Carolyn, thank you. Well, as I say, we did invite ministers onto the programme, but no one was made available. I can now talk to Dr. Jane Townson, the Chief Executive of the UK Homecare Association and one of the signatories of this letter that Carolyn mentioned. Good morning. What is your issue with having people mandatory jabbed?
Good morning. Well, as Carolyn said, we strongly support vaccination of the home care workforce, and we lobbied hard right from the beginning to enable ease of access to vaccinations. So we persuaded government to open up the national booking service so home care workers could book easily. And we're really pleased that only 7 months in, we've managed to get 81.5% of home care workers having their first vaccine and 68.5% with their second dose. Our concern is that vaccination as a condition of deployment will, as Carolyn identified, likely result in a substantial loss of the workforce. And right now we are experiencing challenges which are greater than anyone can ever remember. And we feel it's very important to balance risk here. Vaccination was only ever part of the infection prevention and control measures. We also need PPE and regular testing and other measures too. Recent data from Public Health England, from the Centres for Disease Control in the United States and across the world, indicate that the Delta variant of COVID-19, the viral load is as high in vaccinated people as it is in unvaccinated people, meaning that it can spread just as easily by vaccinated people. Therefore, the argument that it will help to protect older and disabled people is somewhat diminished. Obviously, vaccination will protect care workers.
You have to be incredibly careful as you're saying this on the radio, even though you're making your point about workforce, because aren't you worried your message is going to be hijacked by those who don't want to be vaccinated at all?
What we're arguing for strongly is for persuasion rather than compulsion. So in London, for example, the integrated care system has worked really hard to support vaccine hesitant staff in care homes. And by having those conversations one-to-one, listening to people's concerns and explaining from a clinical perspective, with their respected knowledge as GPs or nurses or pharmacists or other health professionals, has really shifted the needle. And 9 times out of 10, people will go ahead and have the vaccine.
Can I ask then, how many people right now, you're the Chief Executive of the UK Homecare Association, how many people are not jabbed going into people's homes to care for them?
Well, as I said earlier, the national data from this morning is that 81.5% of home care workers have received the vaccine. So that means that an average of 20% haven't.
And do you know? So if I'm sitting in my home this morning receiving care from a home carer, from someone who comes in regularly, maybe I know them, maybe I don't, do I know if they've been jabbed or not?
Well, every home care provider knows which of their staff have been vaccinated and which haven't. And some people receiving care have said, I definitely want someone who's been vaccinated, and that can be arranged. But as I explained, PPE, the regular testing, all of these things are also very important. Just the vaccine on its own will not guarantee safety.
No, I understand that. But right now, I would, if I was a client, I would be able to refuse you or refuse one of my parents receiving care from someone who wasn't jabbed.
You can ask, and everybody, that's already happening, and care providers are doing their absolute best to accommodate that. I think
Can you guarantee it? No, because this is a very important point. You're saying you don't want this to go in the way that it's going if the government say it has to be mandatory, because you don't want to lose people from the industry. You're talking about, and we've had this conversation on the programme before, how to convince people who are hesitant of the data, and that's an important strategy. But are you going to let people say no to carers who haven't been jabbed? Because that is a very important freedom the other way.
Sure, yeah, that's already happening. But I think we need to understand the risks, or other risks. So there's always a balance here. So in some London boroughs, for example, the vaccine hesitancy is much higher. So we've got, 68 to 70%, only 68 to 70% of care workers vaccinated. That means if compulsory vaccination is brought in, maybe 30 to 40% of the care workforce in some areas will leave. That means that people could be left without being able to get out of bed, without being able to, have clean clothes, without having food.
I understand that, but I cannot tell you the strength of feeling coming into what you're saying here. I've got a message saying anyone not prepared to be vaccinated shouldn't be working in care. I do not want my elderly relative given any care by a non-vaccinated person. This is a public health issue. Personal choice doesn't come into it. And I've got a queue of messages behind that saying something very similar indeed. So just to be clear, you can guarantee that you can stop someone coming into your home who hasn't been jabbed to care for you if you're asking for it the other way?
You should definitely ask for it, yes.
No, that's not the same as a guarantee. That's not the same as a guarantee.
Well, care providers have got the records. If you ask, they will do their absolute best. And then the alternative is that you choose not to have care at all, or you go to a different
it's not an alternative, is it? I can't choose not to have care.
It's, I can't say enough that we strongly support vaccination. We've done everything we can.
You can't have it both ways. You can't say we don't want it mandatory, but we can't guarantee that we won't give you somebody who hasn't been jabbed. That's not fair.
Well, I know, but then the alternative is that people will go without care anyway because the care workforce won't be there. So what we're saying is, can we just work really hard to persuade the remaining people that haven't yet been vaccinated to get a vaccine? Because when we do that one-to-one, it really works. So we keep people in the care workforce, we keep them in there and be vaccinated. I think, we're going to see some pretty catastrophic results from, 30 to 40% of care workers not being there. So I agree. We have always wanted the care workforce to be vaccinated, but doing it so fast and making it compulsory in this way is going to result in many people leaving the care sector, which will leave people without care. So
and leave people without jobs, of course, in that respect. Just finally, I'm sorry, our time is up, but when do you expect to know whether it's going to be mandatory or not?
Well, the consultation has not yet been released. It's going to be released imminently because we saw a draft a month ago. That process will go through, but we believe that the government is minded to press ahead. So it will be, I'm guessing, sometime after the care home people, but as soon as the government can make it happen.
Well, we can talk again then, I hope. Dr. Jane Townson, Chief Executive of the UK Homecare Association, thank you. We did ask the Department for Health and Social Care if we could talk to the Minister, Helen Whately, about this. Haven't heard back or a latest statement on that, but we'll keep you updated